Parenting in COVID-19. What a mess. Many of us will find ourselves in this situation. You may have to now work at home. Where are you going to work? The dining table? The basement? In your bed? And your children? Where's your children? Well, maybe you've got 1, 2, 3 kids. I'm not too sure. However, they will have classes and they'll come running in the middle of your Zoom conference or your lecture meeting or whatever you're doing at work. And mommy, daddy. And then the dog comes up or the cat comes on your lap. It's a Wild West situation. Here are a few pointers to help us, 10 pointers to help us parent in this difficult time of COVID-19. Prevent boredom. Bored or frustrated children are more likely to act out. Many children have had their lives disrupted. They are out of school. What do you expect? And they can't play with their friends. Try to keep kids busy with a healthy and productive schedule at home. Number 2, address their fears. Children who are old enough to follow the news. Now, you don't want them to be watching the news too much, but go ahead and explain to them, for example, you are their parents and that they may feel that you're going to die. But you're going to explain to them that medical research about COVID-19 shows that healthy people under 60, if you're under 60, are less likely to get very sick and die. Talk with children about frightening news they hear. Number 3, use time out. This discipline tool works. It works best by warning children they will get a timeout if they don't stop. Now also remind them when they've done something wrong in as few words and with as little emotion as possible. Then remove them from the situation for a preset length of time. For example, 1 minute per year of age is a good measure. Number 4, redirect bad behavior. Sometimes children misbehave because they don't know any better and need some guidance. So find something else for your child to do. Number 5, know when not to respond. As long as your child isn't doing something dangerous and gets plenty of attention for good behavior, ignoring bad behavior can be an effective way of stopping it. Now, ignoring bad behavior also can teach children natural consequences of their actions. For example, if your child keeps dropping food on the floor purposefully, there will be nothing left to eat. Number 6, why don't we just praise children sometimes? They need to know when they do something bad and when they do something good. Now, notice good behavior and point it out. Praise success and good tries. This is particularly important in these difficult times when children feel very, very isolated and separated from their friends and from school and their usual routines. Number 7, allow time for attention. You know, the most powerful tool for effective discipline is attention, to reinforce good behaviors and discourage others. When parents are trying to work at home with children who are out of school or childcare, this can be very tough. Clear communication and setting up expectations, particularly with older children. This can help with a lot. Number 8, we need to avoid physical punishment. We are reminded that really physical punishment, hitting, spanking, or corporal punishment, this methodology runs a risk of injury and is not effective. And ultimately, we can worsen the condition and cause long-term effects mentally and physically in a child. They can also learn how to be aggressive. And in fact, research shows that it may be harmful, and the child may have an abnormal development, not just mentally, but socially. It also affects the child's sense of safety in the home and security in the home, which are very, very important in these times. We are reminded that we need to be very careful as caregivers and parents not to shake or jerk our children, because this can cause permanent injury and disability and even result in death. You know, some tips for calming fussy babies and advice for caregivers who reach a breaking point, a tough moment. If you have a friend, a relative, or a neighbor with a new baby at home, think of ways you can reach out and provide support during this time of isolation for all of us. Number 9, take care of yourself. Caregivers also should be sure to take care of themselves. Time to have some physical exercise, time to eat well, time to sleep well. Find ways to decompress and take a break. If more than one parent is at home, take turns watching the children, if possible. And number 10, remember to take a breath in addition to reaching out to others for help. We are recommended as parents, when we feel overwhelmed or especially stressed, try to take just a few seconds. Ask yourself the question, does this problem represent an immediate danger? How will I feel about this problem tomorrow? And is this situation permanent? In many cases, the answer will be no. It will deflate the panic and the impulse to lash out physically and verbally.